Welcome to Chinese Medicine 21st Century. My name is Theresa Mhanna, and I hold a doctorate in acupuncture and Chinese medicine, a master's in Oriental medicine, which covers my herbals for formulas and being able to do compounding and dispensary. And I hold a license for acupuncture through the National Association of Chinese Medicine and through the Ohio State Medical Board. Today we're going to talk about Chinese medicine, but first I'd like to introduce you to my colleagues. There's three of us. We are at the Pavilion TriHealth on Pfeiffer Road. So we have Jenna Robinson. She specializes in men's health. There's Linda Zhao. Let me go back. Linda Zhao, and she specializes in children, and I specialize in PTSD, stress type of disorders like that. And we all specialize in pain and headaches and overall general knowledge of medicine. Okay, acupuncture, working together with other medical professions to heal the soul, body, and mind. Softer, gentler, warmer, and kinder. This is my funny joke. It's not quite how it is, but we're going to learn what happens in an acupuncture office. We're going to learn about the different types of styles, the modalities that go with it, functions of the body according to traditional Chinese medicine, which is what I practice, and so do the other women, but you'll see as I talk that it crosses over a lot. So what makes a well-qualified acupuncturist? You know, you want to feel safe and secure. We will be covering these topics. A typical acupuncture office visit, indications for acupuncture and the future of Chinese medicine in general. There are no magic needles. Sometimes people think that we're curing them. No. We'll be discussing homeostasis and other things that's really happening in the body while acupuncture is taking place. So, what is Chinese medicine? It is a 5,000-year-old medicine. It originated in China. It includes acupuncture, herbal remedies, Tai Chi, or Tai Chi, as some people pronounce it, Tuina, which is Chinese massage, and Gua Sha, which is scraping of the skin gently, like we're not tearing your skin off. It will look like it sometimes, but we're not. So, and other modalities that support strengthening and homeostasis, because that's what's taking place. Traditional Chinese medicine practitioners looked at signs and symptoms to treat root causes using TCM theory, so we're just not putting a Band-Aid over stuff. We're really like getting into the root cause. There are over 2,000 acupuncture points on the body. Okay, and it is not snake oil. Hang on, which one are we on? We're on number 7. Hang on, let me go back to 7. Okay, so it is a real thing. Okay, it treats arthritis and bursitis in China, and they still use it actively today. The thing is why it got a bad rap is because during the 19th century, they started using rattlesnake, but in China, what they use is they use a sea snake to get the oil, and it's a lot more stronger and very effective. So, the history, the inner canon of the Yellow Emperor, and that's a book that is our basics of TCM theoretical concepts. In this book, they are mostly notes taken by his 6 ministers/physicians that he spent a lot of time with. But this is what he looked like, and if you buy the book, you'll see his picture on it. And this is, Chinese do more of a Buddhist style. So, okay, so history in America, this is Franklin Bach, and in 1826 he did experiments on a bunch of prisoners for pain, and he is the first notes that were taken in America for acupuncture that proved that was very effective for pain. Acupuncture styles of theories is what I'm going to cover now. In modern day success, herbal medicine and acupuncture includes theory, practice, diagnosis, and treatment, and understanding theory. In traditional Chinese medicine, acupuncture aims to open the blockages or reduce the excess of qi flow through specific channels in the body, known as meridians. Under the ideology, health is not simply the absence of disease, but rather the functioning of interconnection of wellness. Given the overall positive patient response, limited side effects, and little to no cost on the healthcare system, acupuncture is an essential alternative treatment modality. And this is according to PubMed. This is research that they have been working on probably for 30 years. And we are finally really showing great results on what acupuncture can do for the body. And in our healthcare system today, well, TriHealth is offering acupuncture, massage, and other healing arts modalities, such as even sound therapy. And this is happening across America in all the major hospitals. And so this is where they want to take medicine, because we don't, it's been such a burden on the health care system, and this is our turnaround for it. So we're really encouraging people to take this type of action. Theory, one of the theories is yin and yang, is the concept of balance between day and night, earth and heaven, soft, hard, and we use this in your body, such as the back is yang, the front is yin. You know, the inside is yin, the outside is yang, but that gets broken down even further in your body as we look at it. And we will look at this here. Okay, we address the mental, physical, emotional, and spiritual self. TCM is based on that principle, and the body organs are connected through these meridians, and we'll show you here in a minute. And my little man up here shows you too. Like, you see all the little lines on him? Those are the 12 main meridians on his body and where they run on the surface of the body. And one is for the gallbladder, one is for the heart, and we'll talk about this more. And yes, meridians have been shown as the Journal of Electron Spectroscopy and Related Phenomena. They published a research study that showed CT scans revealed clear distinctions between the non-acupuncture points and acupuncture points anatomically structures when using inline phase contrast CT imaging with synchrotron radiation. So this is how they were able to notice this. And these lines, they run in the fascia of your body, which is like the glue to your body. It holds everything together. An example of the fascia would be a raw chicken breast with the skin on top. And if you pull the skin up, you always see this real thin film. That's your fascia, and everybody has it as connective tissue. Okay, and these are the meridians on the body, just like the man. And now these meridians are the electrical grids of that make the form of the human body, such as what makes the form of your dogs. It is the electrical grids that make up a dog, so to say, okay? And they all operate at a different hertz, like sound, a different, that's how sound therapy comes into different touches. So in this slide, it shows your wrists, and this was on the left, and resting with no needles. And you can see certain of the points, and the points are like up here on the left, LU9 and LU8. Okay, so, and then when they put the needles in, you can see where those spots got a lot more intense. Okay, so the circuit of meridians, they have an energetic flow. Okay, so first organ is yin, which they call Gong, and there's 6 organs of that. And then the second organ is yang, and it's called fu, and there are 5 organs of that. So when you see lung and large intestine, those are pairing organs. And we like to say in element theory that they're married because they interact so closely together that if something happens to one, it will happen to the other much more, or probably more easily. Zhang Fu theory. So I broke this down. You have yin, which is the heart, spleen, liver, lung, and kidney. And they produce, store, and reserve qi, blood, and essence. And then the 6 fu organs, they, which is stomach, small intestine, large intestine, urinary bladder, gallbladder, and sanjiao. They transport, transform, digest food and substances. And then you have what we like to call 6 extraordinary organs, and this is the uterus, the dantian, the bones, the blood vessels, the marrow, the brain, and the gallbladder. And they store essential substances. She flows along the lines of the meridians, which I've been talking about. And Qigong exercises are designed to help you preserve your Jing, which is Jing. Jing is like what you're born with. It's the essence that your parents gave you, and it sets the timeline for how long you would live. If it was absolutely perfect, how long you live, your youthfulness, or maybe you were born with a disability. It sets all of that. Okay, and we have a choice on how we treat our bodies through food and exercise and health care, on preserving that Jing. But most people don't. We have horrible diets and crazy lives, so we'll talk about that too. Okay, so, and we offer, here at TriHealth, we offer Tai Chi and Qigong with our beautiful Law, and Reiki from Nikki, craniosacral therapy from our massage therapist Jennifer and me too, and sound hearing from Jessica Kirshner, and she's really great. Okay, this is one of the tools we use in Chinese medicine. It's our meridian clock, and you know, people who have difficulty with waking up at 4 a.m. or between 3 and 5, we will know that, oh, they've got maybe some grief going on, or maybe they've had a recent cough or chest cold, and they're weak right there. And they're more than likely to wake up at that time if people have a tendency for that. It's not a, it's a small piece of the puzzle. It helps support everything else that we would look at when we're doing a intake and evaluation of signs and symptoms. Okay, safety. Safety is really big. So it's very safe, okay? And with the first paragraph here talks about the herbs. And there have been some recalls on stuff, and there have been with the Ma Huang, which is ephedra, This is something that America pulled off the market because it was being misused by the dietary companies, and it had killed a couple people. So it took it off the market for everybody. But it was something that had been safely used in China for centuries, and it is used for lung issues. So think of asthma. Okay, the second paragraph deals with needles. And here at TriHealth, we use stainless steel, sterile, single-use needles. They come in little packages like what you see in front of you. Really, like it's like a 0.0000 something of, like, you know, getting blood contamination, because that's the big thing people might worry about. So no, we don't use needles on anybody else. But there is a second way that if you leave the country that many countries might use, and that is an autoclave needle. So they're a little bit bigger, and well, they just, you know, clean them. Autoclave is extremely safe, but that's not what we choose to use at TriHealth. So, and let me think. The third, the Tai Chi and the Qi Gong. I can't think of anybody ever hurting themselves, because it's such slow movement. It's more about the internal, and really take it at your own pace type of thing. But Tai Chi is, we're talking about that more here. Okay, so if you're trying to find a practitioner, maybe you've got a family or friend somewhere across, out in Arizona, out somewhere. So this is where you would go. You just type in your computer, find a practitioner, and this site is our regulatory board, and who monitors, you know, our CEUs and everything. And so, and these are qualified, and you're getting like a lot of other modalities. It's about a Chinese thinking on how you see the body when you go through this organization. So, 5-element theory. Okay, I kind of covered some of that, but we're going to cover a little more. Okay, and this is the funnest theory if you ever look it up, because so let's take the liver. So, and the gallbladder. You know, its element is wood. It manifests in the eyes, like, so if you have floaters or dry eyes, it can be the liver, you know. It also manifests in the tendons and ligaments. It says anger there, but it's not necessarily anger. It could be irritation, frustration, a lot of sighing. Because it's the steam pot or tea kettle letting out the steam. That's how I like to look at my liver. You know, it takes a lot of the brunt of everything that's happening all day. So, and then you can go to also the lung, which is related to the large intestine, affected by, or it manifests, or its element is metal. It's manifests through the nose. Fluid is nasal drip, not the phlegm stuff. The phlegm or is the stomach. You know, and the heart, its fluid is is sweat, and this is to help kind of hopefully bring your mind around to see how we look at people. So if someone comes in that's sweating, you know, I go, oh, well, there might be something wrong with their heart if they get sweaty easy, you know. But if their skin's super dry, I go, well, the lungs are probably dry too, because they're that interrelated, because the lungs manifest in the skin. People who have asthma more than likely will have eczema, psoriasis, and things like that. They really kind of go hand in hand. And I did research study in college, and I found that there's actually a DNA sequence that put the skin and the lung together, and that complemented Western medicine on their theories, because I found that they're Western medicine on how Chinese medicine thinks. And I thought that was amazing. So, Okay, this is Korean hand therapy. Now we've got a really cool guy up in Canton, Ohio, I believe, in that area, Dr. Mock, and he does Korean hand therapy. And so we look in Korean hand therapy, your hand is a microsystem of your whole body. Same with your face, your feet, and your ears. So, but they do acupuncture in the hand, and you can see like where the spine is, and these where they would put points. And you can see on the right, all those little tiny points are what they have to learn in order to treat the body where the pain or issues may be. Okay, Japanese theory. Okay, so the Japanese took it from China in the 6th century, and they made their own style, so much so that well, there's Japanese theory. So one of the Japanese theories that I practice this is Campo, and what it is abdominals. So even though we're doing needles still, we use fewer needles in it, but we are taking the diagnosis from your abdomen only, on how it feels, on whether we see a heartbeat or whether it makes certain sounds. It's interesting. Okay, this is our auricular theory, and this is pretty popular in America. So we consider it French because he brought it back to the forefront of what we're doing. And there's a NADA protocol, and this is where we do the battlefield acupuncture. Like we volunteer to go down to Haiti or other places that have been hit really strong with hurricanes, and we don't just treat the people, we also treat the emergency help that is there, because they're experiencing trauma and shock too, because that became really overwhelming to them. So, Sho Ni Shin is what we do for infants and children, probably till they're about 3, and then and if we do acupuncture on children that are older than that, the needles don't stay in as long, and it's and definitely much less. It's a whole different ordeal. But when they're infants, we teach how to massage the hands in certain ways, like what you can see in this picture, and how to do the whole body. The belly, which way to move your hand if they were constipated. You want to do it clockwise. If they've got diarrhea, you want to do it counterclockwise. And these gentle movements work very efficiently with infants. So these are all the things that Sho Ni Shin can treat. Colic, excessive crying, temper tantrums, covered constipation and diarrhea, night terrors, asthma, hives, and we even do stuttering and cerebral palsy just with gentle touch. It's very powerful. Okay, acupuncture. Okay, a traditional Chinese medicine therapy in which pressure is acupressure, sorry about that, is applied to a specific area. So I like to teach you a shun, and a shun is a measurement of that we use for people and their individual bodies. So a shun is about as wide as my thumb, and it is that's one shun. So my thumb might be bigger or smaller than the next person. So what I'm practicing, I have to be very mindful of the type of size of person I'm dealing with, especially with men. They come in when they got these giant hands. I know I have to measure just a little larger. Okay, 3 shuns are the length of your knuckles here in between. So I'll take this wrist, and if I put my first knuckle there in the middle of my, right up against the edge of my wrist and hand, and I lay it flat, I want to bring my finger up like this, my index finger, And this will give you a spot on your wrist for nausea, motion sickness, anxiety. It's very powerful, okay? And that's what, how we find some of our measurements if it's not off of the geographic of the body. Another great point is on Myanmar. And this is an extra point. There's lots of extra points. And so how do we find it? We put our fingers behind our ear in the indentation of the fold. And then you go back and you feel the bone right there. And then you slide it back even further into an indentation. And if you rub this at night, it will help relax you and you find it easy to fall asleep. These are major points like that, or the master point that I would use if someone came in for sleep issues, along with other points maybe to support that. So the question would be, okay, that's a great point for sleep, but what's the root cause? Well, it could be the heart, it could be the kidneys, it could be any of them. So we have to put it all together. It's not just one single miracle. So, next we'll do modalities. We're going to cover moxibustion, laser therapy, electroacupuncture, cupping, tuina, scalp acupuncture, guasha, qigong and tai chi, breathing, and Chinese herbs. So, moxibustion, which is mugwort or Artemisia vulgaris, is a form of therapy, and it actually is a weed out in your yard. But we don't know that till today. So what we do is we burn it, and it's very warming. And I like to use this herb specifically for people who have Crohn's or colitis, IBS type of issues. And we hold it just like that with our hands over that area, or we use cones. There's even on your baby toe, we have pregnant women hold it there several times during the end of their pregnancy in order to turn the babies the way. And it's just amazing what Chinese medicine has had all these years. So laser acupuncture. Okay, this is totally experimental, but it gives you an idea that they are. The research is really being done, and how certain points will light up specific parts of the brain. That's what that was about. Electroacupuncture, which is different than what we just seen, is something we do have in our office. And sometimes people come in. They're so hard in their muscles for back pain. We will use that in order to make a stronger sensation. So, go back. Okay. And some of what I was talking about before is that TriHealth, among with all the other major hospitals in major cities, are really looking for ways to make people healthier again. They believe in it 100%. And so TriHealth offers to their employees 8 free acupunctures and 8 free massages, and they can get it renewed and I'm sure this is not going to last forever, but I just thought that was really impressive and amazing as a hospital that they really support, that they want their employees to be healthy, because it leads with lesser days missed from work. People are less stressed. It's amazing. So cupping, this is one of our other modalities, therapies. So we think of Michael Phelps, but it pulls blood to the surface, and it pulls old toxins too, like if you've had anesthesia or maybe just maybe a lifetime of too much medicine put through your body, that stuff gets stuck. And so we pull it to the surface. Sometimes it leaves nasty marks. And there's Michael Phelps. And but they clear up within a couple weeks, and it is equivalent to a deep tissue massage, and it's a negative pressure instead of positive. And what it's doing is allowing the good blood to get underneath where the pain is and replenish itself, because everything boils down to, how good is your blood? And so that's what we're doing, is help your body rid it. Nobody know, but in The Godfather, nobody, I noticed this, so remember this. What they're doing with cupping with the baby with this is they were coop. They were pulling coop out of him, breaking up in his lungs. And we don't do these modalities anymore, but they're really important to, really important. So Twina, okay, this is like, Chinese massage, and of course, if you've never tried it, you need to. It's like out of this world. Okay, scalp acupuncture. As it says up here, we do this for stroke, people with difficulty talking, Parkinson's, and a lot of neurological issues, okay? And when we do that, we also do it along with the rest of the body in traditional Chinese medicine. And traditional Chinese medicine has been shown to be the most effective and has the most research done on it. And that's why I chose this field specifically. Okay, so where was I? Okay, we did that. Okay, gua sha. Okay, gua sha does not hurt. If it does, your practitioner needs to stop, okay? It's not meant for that. These marks that were put on these people were, it's disease that we pull out of the body. But what we're doing is we're targeting the fascia, okay? And gua sha has been proven to make scars smaller by repairing the filaments at cellular level. So even if you go into a surgeon's office and like I've got a scar here on my arm, what they'll do is they'll gua sha that scar, and it will make the scar smaller. So it's very right. On the right, okay, so what it's doing also, it helps with stretch marks. Nobody thought about that, but yeah, that does, and so does cupping. Cupping will help get rid of the cellulite in your legs. Okay, and gua sha, even though that was horrible what you just seen, okay, but we also use it for the face. And what it does is it breaks down the collagen and elastin in order so the face can replenish those and keep you younger looking and fresher. Now, one of the big things that I see people come in are these muscles through here. From looking at the computer screen all day, they just won't untighten. I'm surprised people, like if you look at people, they're real tight there. Gua sha helps break that up, and it can, but we do it very gently so it does not leave marks on people's face. So, Qigong, okay, this is, there's all types of Qigong. I talk with my patients, clients, about getting on YouTube, looking at some videos that are both of those, Tai Chi, Qigong. It's slow movements that it teaches you how to feel and notice what's going on with your body. Oh, I have a frozen shoulder, acupuncture like helps that stuff out immensely. But exercises to go along with that would be really slow movements. And I'm moving my shoulder right now, but nobody should really see it. It's going like this, but that's way too big. That's too young. We went yin. Okay, and we learn to break up the disease in those joints slowly and gently. Softness overcomes hardness. Breathing Qigong. Qigong kind of lapses. Qigong is the basics for everything because you have to have a breath. And a lot of Qigong is mind and breathing. The Buddhists say when you inhale, you nourish the body. As you exhale, you nourish your spirit. And so I like to do a breathing exercise with my clients' patients. It's called Cosmic Orbit. And I start there at in the small of the back. I have them inhale up their spine, counting very slowly to 10 or 11, and taking the water from their kidneys, and it's like a strong flowing, nurturing river. And as it comes over the top of the head, it becomes like a waterfall. And as it crosses your chest, you exhale, taking the excess energy from your heart, leaving your heart a beautiful warm glow. Always keep your heart in like a glass case. It's protected from everybody, but you know it's there to show the world how beautiful you are. So, okay, so as it crosses your chest, it takes that excess energy and it takes it down to the dantian, okay? And this is where we store our energy for everyday use, and it's very powerful. And then we take it around the crotch, this isn't our imagination, around the crotch, back up to the small of our back, and that completes a whole cycle of yin yang, the back being yang and the front being yin. So this is how we think. So in that exercise, what we were doing is we were circulating qi and blood around the cranium, the spine, and your gut, because this is where all the healing and all the what's happening on how we're going to get to the stronger homeostasis. Okay, so herbal medicine. I told you that we have some. We've had some reports of things that were harmful to people, but to make it safe, we have agencies that back us and that are checking for these things. So these things are being caught immediately. And the Public Health Service Act prevents the introduction and transmission and spread of communicable diseases from foreign countries into the United States. And that's really important. It's one of our number one worries of people who come in, and we talk to them about taking herbal formulas. Okay, diet. Nobody likes to hear about diet. But food is what is our postnatal Jing. Remember I talked about the Jing of what the parents gave us? Well, this is the postnatal Jing, and this is what's going to tell us how long we live or the quality of life we have. I've read that God gave us 120 years to live a strong, healthy, productive life. And yeah, we all grow old, but we shouldn't be crippled up. That's not part of the deal. So herbal formulas, okay, so that's what it is about the diet, okay? And so our food is our life. Herbal formulas, we are, all three of us at the clinic, all three of us acupuncturists, we are certified in compounding and dispensary. What we do is we just order pre-made stuff. It's a lot easier and just as effective. Okay, Western medicine has an inherited lineage that could be compensated for by these forms of treatment. So what makes a well-qualified acupuncturist? One, safety, clean needle technique. We are all certified in that. They do a criminal background check, FBI and Ohio BCI. We meet NCCAOM Code of Ethics. That's our governing body nationally. We do CPR every 2 years. We do continuing education of 60 hours every 4 years. And we have to be licensed by the state that we practice in. So in this state, it's the Ohio Medical Board. And extensive educational requirements, which we'll go over in a little bit. And the education here is we have to take 4 major tests. They're really expensive, but we also cover biomedicine or Western medicine, and we do to be for the physician to take is a 300-hour course. Physical therapy is a 24 to 54 or 54-hour course. Those are not us. These are people who they can take weekend courses. We have to through when you are a licensed acupuncturist like I am, we have to take 2,625 minimum, and for our Oriental medicine, and acupuncture program of 1,725 hours, and we have to go 390 hours for a doctorate program. And we are one of the highest amount for continuing education. Licensors is a national certification of Commission for Acupuncture and Oriental Medicine, State of Ohio Medical Board, Ohio Association of Acupuncture and Oriental Medicine, that's for Ohio, obviously, an American Acupuncture Council. We have to carry malpractice insurance, and you have to speak and understand English, but that's their requirements because we are the states. Okay, a typical acupuncture clinic. So you'll come in, and I will look at your persona. I'm looking to see if you have dark circles under your eyes. Are the circles black, or maybe they're green? If they're black, I'll go, oh, kidney. If they're green, I will say, oh, liver. We take tongue and pulse. Let's look at that. So, well, first of all, what to expect. Maybe a light meal. You don't necessarily have to do. If you think that you have your sugar, you feel your sugars drop, get a little wheezy, yeah, bring something with you. Or have a little snack beforehand. Wear comfortable clothes. Lots of times, if I'm treating back pain, you're going to get undressed anyway, basically, at least down to your, undergarments. So make it easy on yourself. What to expect. You expect to be there to an hour to an hour and a half, depending. The first appointment is closer to an hour and a half, just because we got to get to know you a little bit, but we try to make it quick. So, after treatment, you will, you might feel a little lightheaded, like you are high or a little tipsy, but you're not impaired at all. You just need to sit at the edge of the bed. You might get really cold during treatment, and most of the time people really relax. Needles are relaxing. As crazy as that sounds, it relaxes people. So, the tongue, this is what we're looking for when it's tongue. We're looking at the color, we're looking at the coating. Some people have geographical tongues. Some people have teeth marks. Some people have pointy tongues. The pointy tongue is liver, but it might be heart. You don't know. It depends. It's what is all the supporting evidence saying is what we're looking for. This is the pulse. You can see on the left hand we have the heart, the liver, and the kidney. And on the right hand, we have the lung, the spleen, and the kidney. There are 27 different positions that we are looking for, and it's a skill. Okay, indications for acupuncture. Number one is overall well-being and health. It feels good. It really does. And if you have consistent treatments over time, you really start feeling more grounded, like you can take a breath. You feel your world kind of opening up around you. So, but physically, we treat all these things. We help with people who have radiation and chemotherapy, get them in that day or the day after in order to bring their energy levels back up and their appetite, so that they eat healthy things instead of just junk, right? Sports injuries, low back pain, headaches, women who have any type of menstrual or female issues, menopause, you name it. And of course, anxiety, weight loss, we help support that too. If you could think of it, call in and ask. We treat it. Okay. So what we're going to cover now is pain, sports injuries, fibromyalgia, post and pre-surgery pain, spinal degeneration, sickness, such as COVID. We help people who've had COVID, like never got their energy levels back. We help them regain that. Spondylosis, I said that. Wound healing, I've seen a gunshot wound healed up before. I was just amazed. Okay, so research. More and more research is proving acupuncture and other modalities to be effective and safe way to improve health. We use it on our pets, dogs, cats, birds. Yeah. So, okay. So, 2018, the Ohio State of Medicaid, or Medical Board, but they basically made acupuncture the #1 go-to to replace opioids. Okay, so you have back pain and headache, state of Ohio approved it for Medicaid and Medicare. So, you know, like that's what they're pushing everybody into. So, okay, so fibromyalgia, 85% of women, these are some supplements that are important to take if you're experiencing that. And we have different diagnoses for it, but it doesn't matter what the diagnosis or like whether it's the kidney, liver, whatever. We always use spleen 21 for this point because it helps release the pent-upness and it goes to all the meridians that's connected into the muscular tissue. Okay, so post and pre-surgery pain showed that both agitation or delirium and delayed cognitive recovery were reduced after treatment with acupuncture. In November of 21, PubMed published that complementary and alternative medicine has become increasingly popular among facial plastic surgery patients because it takes the swelling down and helps with recovery time. Okay? And select CAM therapies, which is what we've talked about, have been reported to promote wound healing, reduce edema or purpura, and provide anti-inflammatory effects. Okay, and for spondylosis, these are the points that we would use, the Hao-Tu-Jia-Ji. It is the recommendation of the American College of Physicians to use and recommended acupuncture as a first-line non-pharmacological treatment for patients suffering from chronic low back pain. And there are neuroprotective benefits from receiving acupuncture for neurologic diseases, and the MRIs have shown that acupuncture affects broad neurological pathways, stimulating somatosensory affective and cognitive processing. And this is all documented through these research agencies. COVID lowers, okay, so what happens with COVID is you have a cytostorm, and what happens if you were being treated with acupuncture before and after, but before it helped keep that what do they call it, cytokine storm lesser, but even afterwards or during having this sickness, we were able to get people to recover much quicker from it. So we've had great results with that from people. Okay, yeah, here it is. The 2020 research, the treatment, the body temperature returned to normal for more than 3 days, respiratory symptoms improved significantly, and pulmonary imaging results showed significant reabsorption of acute exudative lesions, and the neuroacid test results were negative for 2 consecutive times. And this was through, let me see, the health clinic, something like that. Yeah, Health CMI. And they did amazing research, and I'm really appreciative of that. Okay, wound healing. As I said just before, I've seen a gunshot wound healed, and it is, I in my own office, you know, people come in and if I'm doing whatever I'm doing, if I see like a bruise or, you know, a cut on them, if I put needles on them, it heals quicker. I've seen that happen with people. So this is just doing more research studies, you know. So the safest natural alternative used to expedite people's recovery after major surgery. And there were no major side effects in patients with acute pain proceeding in the emergency department, because they actually have us in the emergency department. They use it for analgesia. You'll see here in a minute. Insomnia, what we do, insomnia patients may experience significant improvement in symptoms after more than 3 weeks of acupuncture treatment compared to pharmacological treatments. You know, digestive issues, foods that calm the autoimmune disease or calm autoimmune diseases. Okay, sweet potatoes, extra virgin olive oil, vitamin E. You can read this, and the reason why I cover digestive issues is because this is like, if you came in to see me, you know, I would be able to give you nutritional advice. You know, if you have autoimmune disease, well, dairies, sugars, soys, fried foods, and processed foods are very inflammatory. I would say, you know what, if you really care about your health, you know, you give it a break for 10 days. And then when you go back into it, you'll start feeling what it does to your body when you start introducing it, and it's really crazy. So, traditional Chinese medicine for management of recurrent and refractory Crohn's disease. This is what I use that moxibustion for. They were substantially improved by combined TCM and pharmacological therapy intervention while the dose of her medication was reduced. Okay, so we help people with reducing their medications, but we're also working along with, like, sometimes people can have medications reduced. So what we do is we work along with the Western medicine to keep people a better quality of life. And what was the, okay. So digestive issues, okay. Crohn's, colitis, reflux, acid reflux, and this again is just research that I've dug up, you know. So, like, and these are the things that get treated. So we and you know, once you get your body under control, you don't have to keep coming to an acupuncture. We recommend maybe every 6 months to a year, depending upon your lifestyle. The whole point is to get you off medications, if you can get off of them, you know, and truly give you quality of life. And as for our herbal supplements and stuff, let's just take regular vitamins, you know, magnesium. Oh, you crave chocolate. Oh, maybe a good possibility is you're low in magnesium. And this will help you with muscle cramps you're having too, but you don't have to like buy the jar and take the whole jar. You know, to take it responsibly, you want to take it for 2 or 3 days until the symptoms clear up, and then maybe a day after, you know, and then you put the supplement up until maybe it comes back again. Maybe that's your constitution, and maybe you're in the middle of still making those life changes, because, you know, you don't lose 100 pounds overnight. You know, you don't cure adrenal fatigue overnight. It's a process, and we're here to help people through that process. So, we help women with infertility. Okay, we help bring blood to the uterus. We help balance their hormones. Actually, we are the number, besides going to a fertility doctor, if they come to us, we up their IVF by 30%, the chances of getting pregnant. That's really high to, like, and they're expensive too. So it's definitely worth, you know, a few $100, you know, to up your chances of that IVF or that egg developing, you know, and well, that's what we do. Okay, so next, we're going to start emotional stress, anger, grief, depression, PTSD, angry, or anxiety, fidgety, all these, no willpower. You know, maybe you feel stuck or just not like plateaued off. So these are all the things that we can address. So I'm not going into each of these slides afterwards. It's too much. Okay, so the future of acupuncture is preventative medicine. We're going to cover the Nobel Bell Prize lady, primary care physician, anesthesia, and cosmetics. So as a preventative medicine, the article states that preventative sessions of acupuncture reduces overall fatigue, reduces the numbers of days of sickness per year taken from work, the amount of medication that is needed, and the number of medical consultations. So that's why all these hospitals are looking at this, and why big corporations are looking at this too. We actually go around, they have us go around to their offices, at least the massage therapist, and give massage to employees to de-stress them. So it's just a very generous thing that TriHealth does. So this is Tu Yu. She is our Nobel Prize winner. Because what she did, she did research and stuff about the herb Artemisia annua, which is Chinese, Qinghua Su. And this is sweet woodworm, and we've all kind of familiar with it, but it is the #1 herb that fights malaria. And so she was really recognized for that back in 2015. So, okay, so for primary care physicians, okay, Florida does recognize acupuncturists as a primary care physician, and California is actually the leading person with any type of these Chinese or healing arts, and so they're really strict. They have crazy standards. But yeah, they've got a whole different title than primary care physician. We're primary health care professionals, what they call us. Okay, so this is our anesthesiologist, Dr. Yu P. Mock, up in Akron, Ohio, I believe. Okay, and and of course this is Tony Stark, Iron Man, and you see the acupuncture needles on him, and this is what Dr. Mock does, and they combine them both. So you can be awake during surgery, plus they use a lot less anesthesia, so it's lesser cost, and plus a quicker recovery time, because you know you're not all drugged up. So, okay, cosmetic acupuncture. This is it's equivalent to Botox, and so you just have to go through 10 sessions of them. It's a little different, time consuming, but if you're really into being careful about what you're putting into your body, it's 100% worth it, and it's out there. But here at TriHealth, we have Linda Lee, and she is our esthetician, and so that's who we've referred to also a lot. She does these, microblading, and she does these beautiful facial rejuvenations, and then you can't walk out feeling beautiful. And so this is what her facial rejuvenation would do, and plus acupuncture does this. Before and after, you see she looks more alive in the second picture, and in this one, her complexion cleared up a lot. It's pretty impressive. And then, of course, for hair, let's cover all the beauty products. We're covering hair. And so there are premature hair grain and thinning may be attributed to deficiencies in the kidney, the liver, blood, spleen, and stomach. And this has to do, you go, so I'm frustrated all the time. Listen, my liver, work is a pain, or, so just life's overwhelming or whatever, so that's like it's pounding on the liver for a while, and then hang on. Let me go back. Okay, pounding on the liver for a while. So the liver, because it's aggressive, buddy, it just goes, oh, I'm mad. And so he comes over and he beats up the stomach. So now the spleen and stomach are causing the hair, you know, because you're not getting the nutrients you need. And it's really kind of a domino effect that happens. So what we do is we have formulas that, the bottom here, He Shu Wu is fleece flower root. It's for long, strong hair. And the formula Yu Gua Yin keeps, we actually can keep people's hair darker, longer, like we can like get it to go back, maybe not to like black, but maybe, you know, a light brown, you know, it comes in nicer. And I don't want to say it's reversible, but I have helped people regrow their hair. I had a woman come in and had a horrible accident where had a wig that took off her top of her scalp. It was glued on too long. And she was going to a hair doctor, but she also started coming to me, and I was doing needling and other modalities, and within a year her hair was like growing back. She didn't have to wear a hat to cover it up anymore. So, and these are all the credits that I give everybody, and these are two great books that I recommend to start off with: The Web That Has No Weaver and The Yellow Emperor's Classic of Internal Medicine. It gives a real good insight to Eastern thinking and culture, and they're good reads. They're easy reading, interesting. And thank you. Thank you for your time.